Hello and welcome to Elevate, the official podcast of the Hampton VA. My name is Dr. Carson Furman, and it is my pleasure to welcome you to our inaugural episode. Before we jump into our conversation today, I did just want to give you a little bit of background about the podcast itself. Ultimately, our goal is to provide you with a good source of professional development and also celebrate one of the greatest parts of the Hampton VA, its employees. So about once a month, we're going to be releasing a new episode on some kind of professional development topic. Sometimes this is going to be a bit more specific to something like some sort of recent innovation in healthcare or how to be a servant leader, but we're also going to take time to sit down and talk with employees who have had really unique career journeys here and basically find out what has allowed them to be so successful. So without further ado, let's go ahead and jump in today. I'm joined by Ms. Ashley Montgomery, who's the High Reliability Coordinator here at Hampton. Welcome.
Thank you. Happy to be here.
Absolutely. I was going to say nice to meet you, but we've already done that before. So I'm sure a lot of people at Hampton are already familiar with you and have met you in the course of your work, but just in case they haven't, I'm going to go ahead and read a little brief bio about you, if that's okay.
Sure.
All right. So Ms. Montgomery joined the Hampton VA in 2013 as a recreation therapist with CLC. Prior to this, she had worked as a recreation therapist in several different forensic, pediatric, and adult inpatient settings. Even with this diverse background, if you ask her, she will tell you that she has always had a passion for working with veterans and wanted a career with the VA. In 2020, Ms. Montgomery began engaging with High Reliability as a unit-level High Reliability Champion and High Reliability Committee Recorder. These roles ultimately led to a detailed position in High Reliability and then a formal transition from recreation therapist into her current role as Hampton's High Reliability Program Manager. In this position, Ms. Montgomery is responsible for all Hampton High Reliability efforts and directly supports Dr. Simmons and other members of the executive team in implementing high reliability strategic goals. As a result of these efforts, Hampton has had its patient safety culture scores on the AES increase in every category over the past year. Fantastic. AES scores related to supervisor trust and no fear of reprisal have also both increased. Also fantastic. Ms. Montgomery is also a certified ProSci Change Manager, NCPS Team Training Master Trainer, and HRO Baseline Master Trainer. So welcome again.
Thank you.
Awesome. So high reliability, you mentioned that a couple of times. Yeah, just to be right. For anybody that's not familiar with that, what is high reliability?
Sure. So a high reliability organization, that's an organization that functions in a high risk or complex environment, but are able to avoid failures.
Okay.
So
yeah, absolutely. So functioning in a high risk environment, avoiding failures, what does that kind of boil down to essentially? Like what areas does that touch on?
So within the hospital settings, all areas, right? Because, looking at safety, process improvement, things we can do to, make our processes better for our patients.
Absolutely. So it sounds like a lot of time with staff, obviously with the executives, meetings about meetings, no, just kidding.
Yes, all
right.
meetings.
Yeah, absolutely. So what prompted the transition to high reliability from recreation therapy? Because obviously that's a very frontline, clinical, day in, day out, seeing patients, and then obviously transitioning to this role.
Yeah, so I definitely went from a frontline clinical staff into an admin role, essentially, is what this is more or less. So, so why did I do that? I guess, right, is your question. So, when I was on the CLC as a recreation therapist, I really enjoyed, taking care of our patients and working with them to help better them, right? But in understanding and learning about HRO as I was the champion, I really saw it as an opportunity to help the organization as a whole rather than just the one patient, that I'm seeing in that moment. But it started out as I became an HRO champion for the CLC. So when our hospital first sort of took on HRO or becoming an HRO, the first thing that they did was sort of solicit for, to all employees for staff to become HRO champions. And so that's kind of where I started. And that I had never heard of HRO before. I didn't know what it was. But I knew that it had something to do with patient safety and culture change. And I've always been one who I enjoy change. I think change is good. And I've always had an interest in patient safety. So that's kind of how I got into it.
Yeah, absolutely. So it sounds like a couple of different things, right? So part of it is I wanted to make a larger impact, I guess, then, right? Not that patient care is important, obviously, but on a broader level. and then I eased my way into it, right? It sounds like doing two jobs at once, maybe on some level.
So yeah, well, as the HR champion, that's a collateral duty, right?
Oh, okay.
So yes, I did that, and then there was a detail for the position, the actual HR coordinator position.
So it was more of I'm gonna dip my toe in the pool.
So I was
first.
I became a champion first,
Okay.
and then I was also the recorder for the committee, so like the secretary, if you will, for the committee. And then heard that, the position was going to be coming available for a detail, and I was interested because I had then learned what HR was, and I was very interested in it. And so got the detail. I did that as a co-detail with someone else, which was actually very helpful.
Absolutely.
I think we both were sort of learning as we went because it was still fairly new, I think, to to our VA at the time.
Mm-hmm.
And then that led into the position becoming available as a full-time position. And
And we're here, Oscar.
yeah, it's been 3 years. I think it's been 3 years.
Right, absolutely. So what does kind of the overall scope of your job look like day to day now? Because it's obviously been a very progressive journey, but now you're in it, right?
Yeah, so it's funny when people ask me, what do you do on a day-to-day basis? It's really hard to explain because, every day is different, right? I have to kind of build my time around the meetings that we have, of course, and, build my time around those in order to work on, whatever projects, if you will, I'm working on at the time.
Yeah.
So a lot of, working with our patient safety managers, I talk to them multiple times throughout the day.
Mm-hmm.
Also with process improvement, our systems redesign coordinator, work with him a lot as well.
Absolutely.
It's really hard to narrow down your day to day.
Right. Absolutely, right. Only the easy questions, right? And it sounds like there's also a lot of more complex stuff to that as well, too, right? Because it's also supporting the executive team directly, so also very active and obviously like on, different calls, meetings, what's that like?
Yeah, so all that was very new for me in this role. So that was a learning curve and an adjustment for me. I had never, being a frontline staff, I had never really been in a role where I interacted with our ELT members much. And so I had to, kind of get used to that, I guess. In the beginning, it was an adjustment. I was, of course, very nervous, right?
Of course.
But they too are humans, right? Just like we are. So it became, easy after, you do it a few times. But it was definitely nerve-wracking in the beginning.
Oh, yeah, absolutely. And a huge transition from patient one-on-one to like big important group, right?
Yeah.
Absolutely. Was there anything that helped support you in that transition? Kind of moving. It was obviously again progressive, but
well, I'll back up a little bit and say I had a very supportive supervisor who allowed me to first be a champion, right? Because I had to have, be able to do that. Was very supportive in allowing me to do that, and then supportive in allowing me to do the detail. So I will say, when you talk about support, I certainly had that in the transition, because when I was doing the detail, I was actually still seeing patients in the CLC for therapy too, so I was trying to juggle both.
That was good too.
But I had a very supportive supervisor, and so I'm very thankful for that because it gave me the opportunity to kind of like dip my feet in HRO and see what it was all about. But then when I transitioned into the role, supportive wise, I definitely had a mentor. There was a person who was in the role before me, who was still here, but she was in a different role. And so she was super supportive and kind of allowed me to, or helped me transition, because it is a big jump from clinical to admin.
Absolutely,
it's a lot of adjusting your time, right? Because I was used to knowing what I was going to do at almost every hour of the day, right? Seeing patients, what we're going to do. So, but very supportive. Like I said earlier, I had to learn to speak in large crowds, with executives. I wasn't used to doing that. And she was very supportive in talking me through, here's some things that could help you, or, kind of giving me pointers, or, feedback afterwards, like when I was doing presentations and things like that. And I was always open to that. I'm always, willing to learn, of course, so that was helpful.
Yeah, absolutely.
I think having someone, kind of there to, I don't know, like help me through the
Yeah.
waters in the beginning was
Well,
super helpful.
And especially somebody that had already done the job too, right? Because
Right.
there's that technical piece, but then also that very like, no, I've really been there before. Right?
Yeah, absolutely. That was huge. Yeah.
Absolutely. So it sounds like a combination of mentorship, but then also just supervisor support.
Yeah,
Yeah.
absolutely. I definitely have both.
How did those things feel a little bit different? Because on one hand, obviously, like there was that initial, like absolutely, like let's support you and kind of get you going in this direction, but then also kind of like coming alongside to almost
Yeah.
help, you know.
To me, the coming alongside piece was huge. You know, I
Yeah.
think having that in a new role is important. And I think even if the person hasn't been in that role before, just having somebody that you can go to say, hey, I'm supposed to do X, Y, and Z. I've never done that before.
Right.
Do you know?
Yeah.
You know, I think having somebody to be able to do that with is helpful, especially in a role like this where, you know, I'm a one-man office, right? It's
Yeah,
just me. I don't
absolutely.
have anybody else, so it's nice to have. It was nice to have that.
Oh, absolutely, absolutely, and especially like with stuff like what do all these different acronyms mean, right? I know that that's a huge like
Yeah,
just like
and knowing which meetings I needed
Yeah.
to go to, which, you know, meetings I was a voting member
Yeah.
of, you know, all of that
What
stuff.
that means.
What that means.
Absolutely, and even knowing where to be able to go for that, right? Because it's one thing of like, oh man, now I gotta go on the intranet and find all this stuff versus like, hey, no, I've got somebody in my corner who can help me out with that.
Mhm.
Yeah. Was there anything you did to look for that mentorship relationship, right? Because obviously there are sometimes where these things just naturally form in the course of doing business or whatever, but sometimes it's more of no, I'm gonna look for somebody like this. Did anything like that come up?
No, I mean, I think because she was already in this role, so it was easy to like ask questions,
Yeah.
and she was supportive and willing to help me, you know, transition. So I don't know that it was anything specific that I was looking for.
Absolutely.
But I mean, for me, having the feedback, you know,
Yeah.
from that person was helpful. So
Sure.
I definitely always look for the feedback for sure.
Absolutely. And I think maybe that's the key is I looked for it, right? It wasn't just a, like I'll just kind of wait and see what comes to me. It was,
Yeah.
I'm gonna go out and kind of feel this
Yeah,
a little
yeah.
bit. Yeah. Was there anything else along the way that helped looking back or was something that was helpful for you in this process? Because obviously the one thing I hear definitely is it was very incremental, right? It wasn't just shove you into the deep end and best of luck,
Yeah.
right?
Mhm.
Like, was there anything else that helped with this?
Well, in the beginning of coming into the role, excuse me, she mentioned a class, Pro-Sci Change Management, that she thought would be helpful for me if I took the class. And so I did take that class within like 2 months of
That's awesome.
being in the role.
Yeah.
And it was very helpful. I still use things from that every day from that class, you know, with change management. That's, you know, the people side of change and how to lead change within an organization and things of that nature. So highly recommend that to anybody. It's through the VA, so I didn't have to pay for it, of course,
That's
which is
all right.
nice, right? You know, you
Absolutely.
can utilize that. But yeah, that was a really good course that I think helped me
Okay.
in the beginning.
Yeah, so definitely kind of along the way, it almost sounds like the way that was positioned with the HRO job that really helped support there.
Yeah.
Was there anything before that maybe you had done either, as a result of like encouragement from supervisor or on your own independently? Because even hey, I'm maybe interested in HRO and I just kind of want to get, dip my toe in the water, that kind of stuff that you've done on your own?
No, I don't think so. Nothing that really comes to mind that I did that in particular besides, kind of stepping out of my comfort zone and doing that champion.
Yeah.
Again, that's really where it all stemmed from because I, didn't even know what HR was.
Yeah, absolutely, absolutely. And certainly taking initiative is its own skill in and of itself, right?
Absolutely, yeah.
Yeah, that's, I don't know, sometimes folks, I watched this TED Talk that was so inspiring, or, I just listened to podcasts in the car on my way home.
I
that
did
kind of
listen to
thing.
some podcasts actually about HRO in the beginning, when I was in the detail to help me kind of learn more about it. But yeah, that's probably it.
Absolutely, and then obviously on the job training was super
Yeah.
important, yeah. So looking back at kind of this whole career arc over the past couple of years, right, is there anything that like jumps out to you as like this was either like really, really good or something I would have done differently? I mean, I know we covered a lot of stuff obviously, but like, just as you consider things as a whole.
Within the job itself?
Just within kind of the overall
The
progression, because
transition?
it's been a lot of different steps.
Yeah, I don't know. I mean, I'm glad that I did it. I was scared.
Yeah.
I was scared to even apply for the job.
Yeah.
Because rec therapy was all that I did for 10 years from the time I got out of college until this. So it was really kind of having a little bit of faith in myself that, hey, you can do something other than recreation therapy.
Absolutely.
Not that that's bad, right? I loved what I was doing, I really did. But I was looking for more of a way to help the organization as a whole.
Yeah,
That
absolutely.
feeling of, I loved helping my patients, of course, every day, but having a piece into the organization was just huge. So that, I guess
Absolutely.
that kind of sticks out.
And you're definitely still helping patients every day,
But
right?
yeah, and that's the thing. I had to think of it as, a day to day in the clinical field. I was helping, individual patients, right?
Yeah.
But now I can help all of the patients, right?
Yeah,
In a sense.
absolutely.
So that's kind of cool.
Which is fantastic, for sure.
Yeah.
Absolutely. And certainly we're very glad to have you here because it makes a
Thank
huge
you.
difference. Absolutely. What advice would you give for somebody else who's kind of maybe in a similar spot, right? Like either I just kind of want to make a change or I'm kind of curious about, whatever, and I'm just not sure how to go about it. Like, what would you recommend?
I would say if there's ever a detail opportunity in a field or that you're interested in, that's definitely a place to start. That's a good way to get, I think, a little bit of experience about the position. Again, taking any classes that we offer, whether it be through TMS, the VA offers lots of other, through our education department, I'm sure.
Yeah.
Anything that can really help you as a person grow, I would say I would encourage you to do that. But also maybe like having a plan for your career, right?
Absolutely.
That's kind of what I got to thinking when I started to wonder if I wanted to do something different was where did I see myself in 10 years, right? And I didn't know that I wasn't sure if I would have upward mobility in recreation therapy, and so I think that was huge for me.
Yeah,
I felt like if I wanted to grow as a as a professional, right, I needed to do something different. I just felt like I needed to. So I think having a plan, for what you want to do and think about later down the road would be helpful. And talk with your supervisor. Like when you have that 6 month, I forget what they call it. We just had
Evaluation.
There you go.
Yeah.
Talk to your supervisor, about it then. Hey, I'd love any opportunities that you might see where I could, if there's a committee, that maybe you could get involved in, or something along those lines to kind of give you a shift from whatever it is that you're doing into something else.
Yeah, absolutely.
Change is good.
Yeah, well, change is absolutely good for sure. I think maybe the one thing that goes along with having a plan though is make sure that it's really achievable and you have the tools to do it, right? You don't want to be sitting there going, oh, well, it's another 10 years back to school and then I'll get to where I want to be, right?
Yeah.
Like, what can I kind of do now that would be important?
Right, yeah.
If you're a manager or a supervisor that's listening to this, right, for you having a supportive supervisor at the beginning, super important. Having a supportive mentor, super important, right? What advice would you give to those folks for WOMAs?
I would say ask your staff where they see themselves in 10 years. I think that that's important. I would say as a supervisor to be able to help guide your staff. I mean, I think that we should look at it as an opportunity, to help your staff grow. Yeah, they're not gonna be leaving your service, right? And but that's okay, right? Because we have to grow. But I think asking those questions, when you meet with your staff, where do you see yourself in 10 years? Is there anything that you're looking to, try that's new or different, and be supportive.
Yeah, absolutely. So part of that is listening, but also part of it is almost sounds like having a little bit of courage, right? Because I think sometimes as a supervisor, it's easy to be like, oh no, like if it's too much, like, so-and-so's just gonna, fly the nest and we're never gonna see them again and they're so important. But there's also that, the more you support, the more folks are not gonna wanna leave because that's so.
And and I think as a supervisor, you can help them find those skills or find how to get those skills they're looking for, because maybe they don't know how, or maybe they don't know the opportunities that they have available to them. And I think as a supervisor, you could, help in that way.
Yeah, right. Like even just here's the way to go to even start thinking about this stuff or something, right? Absolutely.
Yeah.
Anything else that comes to mind as we're talking about this? We're getting close to our time for today, but any other like thoughts or like, ooh, one other thing to mention, like that kind of stuff?
I don't think so. Nothing that I can think of in particular. I mean, I'm very thankful, for this job and this role that I have. I enjoy it a lot. It's different, right, than what I was doing, which I think I needed at the time. I still miss, you know, the veterans over in the CLC. I go visit every now and then. But I enjoyed my job there as well. But I'm very thankful that I had the opportunity to do something a little different and make a bigger impact, if you will, in the hospital. So
Absolutely.
hopefully.
Fantastic impact in Lori, absolutely. All right, well, I guess that's as good a place to leave it as any. Thank you so much for being so open and sharing with us. That was
Sure.
absolutely fantastic.
Happy to be here. Thanks for having me.
Absolutely, and of course, special thank you too to Mr. John Rogers for manning the technology side of things. That's always super important in a process like this. Just as a reminder for anybody that's tuning in, we are going to be releasing new episodes about once a month on a professional development topic, so definitely stay tuned for announcements coming out about that. I'm Dr. Carson Furman, as I said before, and it's been great having you all here today. We'll see you next time.